Thank you for staying throughout the program. I'm going to say a few words on why we need a focal therapy society, and I'd like to first acknowledge all the giants in our field and in the room. A lot of them are here at this meeting, and we stand on their shoulders. We can't build this without a solid foundation, and we have pioneers here. Dr. Baus was a leader in cryotherapy and designed some of the first initial equipment. And we have other people here, as was mentioned during the meeting, who are absolute giants. So about us, the Focal Therapy Society aims to advance and position minimally invasive treatments and image-guided cancer treatment in a safe and effective gland-preserving manner to extend and maintain one's quality of life. I'd first like to acknowledge Dr. Vladimir Moraviev. He's the second gentleman on the left. He was probably the inspiration for doing this. You know, back in the day, we had Gary Onick's paper. We had one from Montsouris, Guy Valencione. We had Aaron Katz's initial cryotherapy work, and that's basically all we had. And we met with Peter Scardino in around 2005 and said, wouldn't it be nice if we had a focal meeting for prostate cancer? And Dr. Scardino says, well, I don't think it will work. All we have is two abstracts. We have your abstract from Duke that talks about hemiablation, and then we have the one from Memorial, and you can't run a meeting on two abstracts. But I said, you know, it's going to grow. It's going to take off. And, you know, after that meeting with him, we felt a little bit dejected, to be honest. But, you know, what do we do? So this is one of the first photographs that we have. Dr. Robertson's in the office, Dr. Beldegren, Dan George. You know, we got people to share the vision. And I quote the Beatles, I get by with a little help from my friends. And basically, we met like-minded people. Jean de la Rosette was one of the people that spurred me to brush the dirt off and keep moving forward, because this is something that's going to take off. Michael Marburger was back, John Trachtenberg. These are the initial pioneers. There's a lot of people to name. And I don't want to miss anyone out. But this was the first tipping point, basically getting a community that we could do this. So why focal therapy? I think we all understand that the concept of whole gland therapy is antiquated. It requires less sophisticated tools. Partial gland treatment is common. It applies to most organ systems. And this, like anything that's going to be successful, requires a multidisciplinary approach. You can't do this alone. You need engineers, radiologists, pathologists, industry, and this is where we get into personalized treatments. And this is one of the quotes we have on our website. This is our vision statement for the Focal Therapy Society. By the way, we launched the society in the fall of 2019. Who are we? Well, we've been doing this symposium for 12 years now, so we know each other quite well. We've been working together. We have a history dating back to 2008 was our first meeting, but we started with the concept in 2005. It just took, as I mentioned, a couple years to get enough courage to launch that, and we are beginning to build our resources. We've held meetings basically alternating between Europe and North America, and then Professor Ukimura had the first successful Asian meeting last year in Kyoto. So we are expanding, and we're going into Turkey next. And you can see some of the photographs of the faculty who have been doing this over the years. You can see an earlier picture of Doctors Pinto and Everton in the bottom left in the younger days, Dr. Villers. And we've been doing this for years now. So then what happened? So we're going along doing this, and then I think a real big tipping point was MPMRI. We understand what it is. We can use it for diagnosis, staging, targeting, and biopsy, and this was a real game changer. And I think this really helped propel our field forward. We started talking about targeting and all the benefits of that. And then the publications on focal ablation, focal therapy began to grow. You can see between 2010 and 2019, the number of publications. This doesn't include the abstracts or meetings dedicated to the topic, or symposia at different meetings like the World Congress or the SIU. I think the third tipping point is going to be level 1 evidence. And we have one study, this was quoted earlier by Dr. Gill, Azuzi et al., comparing in a low-risk population TUCAD with surveillance, but it's level 1 evidence, even though it's a low-risk population. We need more, and I think as we get more level 1 studies, we're going to be moving forward. The other thing that I would say is going to be a major tipping point, as we talked about earlier, we had some nice talks on adjuvants, neoadjuvants, how to modify cell kill. Dr. Baus gave a talk on that, is these adjunctive strategies to enhance cell kill. I think, we get a few of these working, this is really going to take off. So why do we need a society? I think we first have to recognize that focal is here to stay, but it needs to be developed further. We've had a number of successes over the years. The concept has been accepted, although slowly. We are an international group. We've put out a number of consensus statements. We've been engaging and partnering with industry for trials over the years, and we have developed an imaging modality that helps us with targeting. So our goal, our vision is to control or eradicate prostate and kidney cancer in a minimally invasive, image-targeted manner while optimizing the preservation of organ function. The Focal Therapy Society aims to be international. We want to host and run multi-site trials. We want to start our own registry. We have been proponents of training and education and will continue to do so. And I think it's important, which was mentioned earlier by Dr. Lepore, we need to standardize our practice. We have to have a way that we all agree that we're going to get our MRI at 1 year, our biopsy at 1 year or 3 years. Otherwise, it's very difficult to compare and move the field forward. And I think these are the things that we're going to be working on. We hope that our devices and techniques will be adopted by regulatory agencies. Our goal is to be endorsed with good, solid evidence into guidelines. We need to get billing codes so we can do this once it's established. And finally, we need to write some white papers on these topics. So as mentioned, in the fall 2019, we have established the Focal Therapy Society. I'd like to encourage you all to consider becoming members. We need passionate people. We have a lot of work to do. There's a number of committees and grassroots efforts that need to be undertaken. So if you have passion and commitment, please join us. We're going to have a part on the website that's going to be available only to society members, where you can share cases and log in and have a chat room. We have leadership positions, board positions. We have the ability to join the founding members. Since it's our first year, you can join us as a historical founding member. Essentially, this is your society. We can do whatever you want or what little you want to do. And I'm hoping that you'll all join me in doing quite a bit. There's a number of member benefits. We can collaborate, innovate with people from around the globe. It's a very inclusive society. We have interventional radiology in there. We will have radiation oncology, medical oncology, whoever wants to participate in this, stay up to date with changes in focal therapy, improve patient outcomes, and participate in the latest focal therapy trials. There's also a way that we can donate, raise funds for a society. We can't do anything without funding sources, and I think this is all important. We're partnered with the Endourological Society, so we are a tax-exempt nonprofit organization. We have a number of upcoming events already planned. We will be at the World Congress of Endourology 2020 in Hamburg. We'll then be at the Focal 2020 meeting run by Arvin George in Los Angeles in the fall, October 1. And finally, October 8th, we'll be in Montreal participating with the SIU. We'll have a special session on focal therapy. Also, the good news is we have, since we've partnered with the Endourological Society, we have Michelle Paoli helping to run and maintain our society. She's there to answer questions, run our phone lines, and whatever help we need. In order to join the Focal Therapy Society, you have to join the Endo Society because there's only one membership fee. So there's a box that you check that you want to be part of the focal therapy, but your dues go to the Endo Society. Thank you for your attention. I hope you'll join me in supporting the Focal Therapy Society.